So there's lots of patients, of course, taking immunotherapy now, and clearly, immunotherapy is the direction that cancer care is going. It doesn't mean, obviously, that chemotherapy is completely gone, and you see lots of things where you're seeing combinations, patients getting chemo and immunotherapy, and that's a situation where chemotherapy can kind of help suppress the cancer growth, while simultaneously trying to stimulate that immune response. And so you can clearly get synergy in those cases. But a lot of times patients are wondering, I'm getting immunotherapy, and what can I do to help that? What can I do to boost that? Well, clearly there's a lot of things. The gut microbiome, as we've discussed many times, is very important. And there's certain supplements, and we've listed a lot of these, camu, and things like that may help. There's studies from MD Anderson showing eating navy beans. It's really interesting to kind of help boost that gut microbiome, but that's something you really want to think about if you're on immunotherapy. The other is off-label drugs. Well, it's challenging because if you talk to your medical oncologist, they're probably not going to be familiar or not want to give you these off-label drugs. They're stuck to a very strict protocol, and that's it's understandable. That's just sort of the way it is for cancer treatment. But it's clear that there are other drugs that you can use to enhance this. My book has discussed this. Obviously that's been many years back, and I'm trying to work on a new book now. But I think clearly a lot of those drugs are still very applicable. I think drugs like sitagliptin, drugs like propranolol, and also now a lot of the monoamine oxidase inhibitors, very, very interesting. The stuff that we're seeing with that, valproic acid. All these things are very interesting drugs and something to consider in patients. And then when you look at supplementation, of course, there's tons of supplements, and you can tell patients to take many things that could be anti-cancer, but it's very difficult for a patient to take tons of things. And so, there's certain ones that you want to really hit on. I like several ones. I like forskolin. I like sodium butyrate. I like AKG. I like TMG. I like PQQ. So there's several of those agents. These were interesting because when we're doing a lot of research on this, we started seeing that a lot of the things that people are taking for anti-aging are also useful in cancer. And when you see that cancer is a disease of aging, now it doesn't mean that cancer only occurs in old people, but cancer causes the tissues to age around it. And this has been seen. There was a study published recently looking at kids who had cancer, and when they measured the methylation of their DNA, this is a way that you can measure aging of the DNA. The DNA gets methylated, that the kids' T cells were equivalent to like 200 years old because they're cancers. And so this is causing an accelerated aging, and cancer causes the tissues around it to age. And so things that are anti-aging tend to be anti-cancer as well, for the most part. And so that's a lot of things that we've seen. And so there's certainly there's lots of things that you can do. I think the thing is limitless, but you have to pick what can you actually do, and those are certainly some important things. And so when look again, when you want to enhance immunotherapy, look at the gut microbiome, look at supplementation that you can do, look at the off-label drugs. Those are areas where you can help get synergy. A patient that's already taking Keytruda, or let's say they're on Opdivo, Yervoy, what are those things that they can do to make those work better? And these are things to consider, and hopefully this information will be helpful for you in your fight against cancer.